Hello and welcome back to Mental Wellness in May. Today we are talking about my top 5 strategies that are more functional medicine based for anxiety, mood, depression, whatever you have going on, because anytime we're talking about the brain, there's so much to dive into. And what I really want to tap into before we begin today is, especially in functional medicine and the wellness community, if you type in like causes of anxiety or what to do, like we could literally blame anything. And a lot of people come to me saying, oh, I know I have candida and yeast. I know I have parasites. I know I have this. I know I must have Lyme because candida causes all of these issues. And like, you look at these blogs and these people are like, literally A to Z, this one issue causes all of these problems. And that's not necessarily true. So I really want to encourage you to take a step back, take a deep breath, kind of organize your thoughts, your mood, your hormones, your energy, your food intake, all of these things. Let's put that really big picture together. So as always, I have my notes, which will probably, they're sticky notes, so they're going to fall down. My number one strategy, no matter who walks in my door, who says, Alison, I have anxiety, I have insomnia, I don't feel good, I'm tired, my joints ache, I have headaches, I have IBS, right? Classic patient is get their blood sugar stable. Now, what most women do, and as I always say, no judgment because I am the first one to do it as well, is they wake up, they have a cup of coffee with their creamer, delicious by the way, and then they forget to eat, or they're too busy to eat, or oh my gosh, we gotta get the kids out of the house, or I gotta get my husband off to work, or my spouse off to work, and like, I gotta go to work, or even I work from home. I literally have no excuse, right? I have the time, but it's still, there's so much effort to put into making food and things like that. And then we don't eat till 2 o'clock, and then maybe we go to Starbucks for a coffee and a muffin or something like that. And by dinner, we're like, oh, I have protein and vegetables and a small carb. And then at 10 o'clock at night, we're in the pantry eating fruit snacks and chips and whatever we can find and a bottle of wine. It's so classic. And that's why the last video that I posted for, I guess, day 3 or 4 about anxiety and insomnia is all about blood sugar. Because if we wake up and we use cortisol to fuel our body, because cortisol will go to the liver will release glucose, and that's how we get fuel and energy for our day if we're not eating food. So if our cortisol is going up and up and up and up and up beyond levels that it should be, we're going to have anxiety. When we tip into adrenal fatigue, our cortisol, we're either not going to make the right amount of it. Our body's going to go, well, we can't make cortisol, so we'll make adrenaline, norepinephrine, epinephrine, things, the things that make our heart go really fast. And people are like, oh my God, I have panic attacks. I can't figure it out why. Every night at 3 o'clock in the morning, I wake up with asthma or a panic attack. There's no rhyme or reason to it. And the reason is cortisol. The other reason is that you're probably not eating enough, so your liver doesn't have the glucose storage that it needs to be able to fuel your body. So I take, really when I start with everybody, I take everybody off of intermittent fasting. Intermittent fasting studies are done on men, and they're done on old men. And if they're done on women, they're done on menopausal women, because women who have cycles and changing hormones and get their periods, they're just way too complicated, and no one wants to do studies on them. That's why there's no research on women. So we can't translate intermittent fasting research on a 60-something-year-old man to a 30-something-year-old mom who just had a baby and is trying to lose weight. It doesn't add up. You have to eat food. So eat food, eat consistently, eat more protein, take a week and track. How many calories are you getting in? How much protein are you getting in? It has to be at least 100 grams. How much fat are you getting in? It needs to be about 80 grams. Carbs, depending on what type of food plan you're doing, what type of meal plan you're doing, can be anywhere. Keto's under 40. Your average should be around 100. Definitely shouldn't be more than 200 unless your macros are completely different and you're like really lifting weights and you're going high, or you're training hard, or you have a really difficult job, you're not sedentary at all. That can get mixed up. So number 1 is blood sugar. Keeping that consistent all day long. I can't tell you how many people, especially young women, especially when I work with the 10 to 20-year-olds, females who are in college or high school, and I know how hard it is because you can't eat between classes, you can't eat during class, like it's so much work. And if you're in college, like there's nowhere to keep the food, like it's this whole thing. Once they start eating food, a month later they're like, Alison, my anxiety's gone. Alison, my car sickness is gone. Alison, I can ride in the back seat and not throw up. Like, oh my gosh, blood sugar fuels and feeds cortisol in a healthy way. It calms down our brain. Our brain and our body start to understand where our fuel is coming from. Oh my goodness. So go back and watch it's like 20 minutes. It's not too long at all. I could talk about blood sugar all day long. If you're on the other side where you're like, oh my gosh, I eat a lot of food. I'm eating like 3K calories a day. I eat a lot of junk food, like pizza, breakfast, lunch, and dinner side. One, of course, we need to clean up diet. We don't have to mess around with that, but adding things in like the Meta Power from doTERRA will help balance your blood sugar. Things like berberine and inositol can help immensely for that as well. So blood sugar is king. Number 2 is sleep. You have to be sleeping. We have to figure that out. If you're not sleeping, your brain's not recovering, it's increasing inflammation, it's ruining the cortisol liver brain triangle that we have when we have insomnia, which goes right back to blood sugar. So if you're not sleeping, number 1, fix your blood sugar. Number 2, keep your room nice and cool. Keep your room as dark as possible, or use a night mask. I've been reading research on how night masks are so actually important for insomnia, because we have so much ambient light no matter where we are, that there's so much coming from our phones and our clocks and just our windows from street lamps. Like if you have a ring light, ours is in our backyard, it goes off and it messes with our brain. So wear a sleep mask to help you. Use your essential oils at night, put them on your feet, put them in a diffuser. There's lots and lots of things you can do. On my list, I have the Serenity, the Adaptive, and the Copaiba capsules are so helpful. Get a weighted blanket, keep your room nice and cold. I think I already said that one. There's lots and lots of things you can do. So if you need more help with sleep, let me know. We can try a couple of things there. All right, number 3, as far as functional medicine side goes, I really like to check people for brain inflammation. So the brain immune axis is incredibly important and is often overlooked because we just jump right to inflammation and neurotransmitters. We totally skip over the part where we have infection. So I do find chronic Epstein-Barr, chronic cytomegalovirus, chronic Lyme, and strep invade the brain, cause inflammation, and are strongly linked to anxiety, depression, and mood changes. So those are really, really important as well. Number 4, I'm going to add to my list is hormones. When I first did my functional neurology and we filled out the brain inflammation form, and I'm like, oh my God, I checked all these off. I have so much anxiety and depression. I was having panic attacks and I was like falling apart. I'm like 10 out of 10 on all of the surveys. And I went up to the doc. He's like, ooh, you need to call Dr. Aaron. I was like, okay. So I called Dr. Aaron. He's like, Alison, it sounds like you need progesterone. And once I started getting my hormones checked out, because my cycles were fine, it wasn't the end of the world, but I didn't realize how much my hormones were affecting my brain. So estrogen and progesterone for women, biological women, directly affect the frontal lobe, directly affect serotonin, dopamine, and GABA. So while you might be sitting there going, oh my gosh, my serotonin's off and my GABA's off and I can't relax, I can't calm down. Well, taking more GABA isn't going to fix that. You have to get your hormones adjusted as well, if that is the issue. So that's a really, really important key that most women miss. And one of my questions that I ask often is, if you had many miscarriages, and if you had, when you did have a successful pregnancy, did they put you on progesterone? And most of the time women say, yes, oh my gosh, and I felt so much better on progesterone, and I had 15 babies, and life is so great. I'm like, that's amazing. You need to still be on progesterone. So that's something to look into, especially with anxiety and depression and sleep. Progesterone can be very, very helpful. Again, these are not overnight cures either. I'm going to add that in. Like, I didn't just take progesterone and be like, whew, wow, my insomnia is gone. No, it didn't. But it did help long term. So we need, like we keep talking about that 10% better, 10% better, 10% better. All right, breathing is so important, and not just regular breathing. But yes, we forget to breathe. So if we forget to breathe, if we hold our breath, if we do shoulder breathing instead of diaphragm and belly breathing, we don't oxygenate as much. And one of the first things that actually suffers is our brain. So when we don't get enough sleep, when you have sleep apnea, snoring, obstructive breathing, how many women or husbands will tell you, like, oh my gosh, my husband snores all night and he has a CPAP, and before that he was so cranky, he was so moody, he couldn't remember anything, and then he got a CPAP, or I got my CPAP, and wow, it's like the light bulb finally turned on. Yeah, because your brain's getting oxygen. Same thing with hair loss. Hair needs oxygen so much. We talk about what supplements to take, but if you have low perfusion in your brain, you're not getting enough oxygen, you're going to suffer. If you have POTS, if you have low blood pressure, you're not getting enough oxygen to your brain. So one of the things that can help is deep breathing exercises, of course. I recommend quite a few things. One of my number one recommendations is Wim Hof, WIMHOFF. He has an app, he has a YouTube channel. I think his app is like $3 or $5 a month. I use it so that way I can keep track. And he has you do deep breathing exercises, and then he has you hold your breath for as long as possible as you exhale, and then hold it, and then inhale it for 15 seconds and hold it, and then go back to your breathing. And that in itself is so resetting for the autonomic nervous system. So we're trying to get the parasympathetics, that stress, to come down, the rest and digest, the parasympathetics to come up, the freeze to unfreeze. Breathing is so key. I saw another research article that said if you take a deep breath in and then another deep breath in, just try and force it all in and then let it out, like 2 breaths in and then let it all out, has shown to increase oxygenation in your bloodstream, your lungs, because you're expanding. So the little sacs in our lungs, so you take a deep breath in, they're like, okay, great, we got a little bit more, and then a little bit more, and then a little bit more. Oh my goodness, you're getting so much oxygen in. And then if you hold that oxygen carbon dioxide exchange happens so much more deeply on a metabolic level. So it's helpful for weight loss, it's helpful for mood, it's helpful for metabolism. Oh my goodness, it's a game changer. Breathing is a game changer. Wearing a sinus strip. I wear one every night just because it helps me sleep so much better, because I'm getting so much more oxygen. Mouth taping can be really helpful as well. Which brings us into vagus nerve regulation. And that's, the vagus nerve is the longest nerve that's in our body. It starts in our brain. We have one on both sides. It comes down and talks to the body. It rules our sympathetics, parasympathetics, and the freeze. Look into the polyvagal theory. I do give almost all of my patients, especially with anxiety and mood concerns, these exercises to do, because it helps reset. The vagus is the master control. So the hypothalamus and pituitary in the brain, and then the vagus are key for helping support with anxiety. Number 1, gagging and gargling are the most effective for the vagus nerve. So pressing down on the back of your tongue with your toothbrush until you gag, and you want the gagging or the gargling to elicit tears in your eyes. That's key. That's how you know the vagus is getting turned on, activated, and balanced. And what's great about our bodies is our bodies, for the most part, know how to bring back to balance. So if you're like, well, I don't want to overactivate my vagus because I'm in overdrive in my sympathetics, don't worry, it's going to help bring that back down. The other thing that you can do is salamander exercises, where you keep your head straight. You just turn your eyes one way and hold it for 30 seconds, the other way and hold it for 30 seconds. I do believe I have the link in the file in this group. If I don't, I'll link that one to you guys for you as well. Number, I guess, 1, 2, 3, 4, 5, 6, 7 is exercise. and this is the worst, this is the one I hate hearing. Like, oh, if you have ADHD and you're depressed and you have anxiety, you need to exercise, and it needs to be moderate intensity exercise to activate the brain, to flush out inflammation, to get oxygenation going. Exercise is the best thing for dopamine, or one of our best feel-gooder neurotransmitters. And I'm like, oh, I don't want to. I'm so tired. You don't even understand. So if you're like me and you're like, okay, I'm right now where I am in my health cycle because my Remicade failed, I'm back to, I'm not lifting, I'm not moving, I just started walking again, I'm doing the best I can. Awesome. That's all I would ask of you for the same, and build up your strength. And you know, I work with patients and they're like, I can't do squats. I'm like, that's okay. Because even body weight exercises are too hard. So when I had to relearn how to walk and relearn how to go up, down stairs, I would just hold on to the banister in our house and just do like one squat, one lunge on each side. And then that was it. That was all I could do for the day. And then the next day I would try to go up to 2 and then up to 3. So go slow. If you're not chronically ill and you're like, oh, I have energy, I just don't have the time, find the time, make the time. Jump rope for 5 minutes. Squats, lunges, jumping jacks, something to get your heart rate up. Keep a set of weights at the office and hide them under your desk, and just do some things like shoulder exercises, triceps, biceps, squats, something to get your heart rate up and your brain activated, and start building up this routine. Is so important for our brain, and it's really hard to do. It's one of those things that just suck until you get it done, and then you're like, oh, I'm really glad I did that. That's the part that we have to keep in our head, that at the end we're like, oh, that was good. I'm really glad that I took care of myself and worked out. Even if it's not, you don't have to kill yourself in the gym. That is not the goal, but it does have to be moderate exercise. If you take a walk around the park, that's great, but it's probably not going to be enough for your brain. So after your walk, or maybe before your walk, do some good heavy work, squats, lunges, body weight, pick up some weights if you can. Okay. And then lastly for today, this is as one of my last things. I have a million things that we could talk about in this article, but seek out therapy, counseling, and psychiatric help if you need to. Anxiety is something that should be managed through multiple modalities. It's not just nutrition. It's not just exercise. It's not just what supplements to take. It's not just guessing if you have an infection and what to take. You don't have to just take homeopathics. We still need to dig into traumas and triggers and what's going on for you, and how to have the tools to manage those things. I am not a therapist or a counselor, and I can't sit here and I wouldn't even pretend that I could tell you what to do. This is something to work through with someone who is a trained professional, who is very familiar with anxiety and depression. Most of them are. And finding someone that you like. And I'll tell you, I've seen a lot of people over my life, and the second to last person that I saw, she spent the first 45 minutes telling me how her day was and having me coach her on her business. And the last 15 minutes, she was like, oh, well, I guess, how are you? So you don't have to work with people you don't like. Not everybody is out for your money. Yes, there are not so great counselors out there. There's not so great people everywhere. So find somebody that you like, that you love, that can work with you, that you feel comfortable, confident with, sharing your information, your story, so you can work through these things with someone who understands. And that way, when you come into these situations, because our life will never be anxiety-free or stress-free or trigger-free, we have to have the tools to manage ourselves, and it takes time. And I'll tell you what, the combination I feel that I've been using over the past few years have really brought me into a new place where, like, I used to be totally terrified to drive to new places. And I drove my son to a new doctor just a few months ago, and I got there and I was like, oh my gosh, I didn't have a panic attack. I didn't cry. I wasn't anxious. I was just like, oh, I'm going to drive somewhere new. It's going to take me 45 minutes. It's not a big deal. We'll find it. We'll get there. And I was like, that is not me. But in a really good way. So I just offering you hope. Like, yes, my essential oils saved my life. Therapy, amazing. blood sugar, I have to stay on top of it 24/7. If I skip breakfast, I'm a hot mess for the day. If I don't sleep, just knock it out for the day. Like, my son is home, so you might notice that, like, you don't see all the cars in the background driving around. He got heat exhaustion yesterday from being at the Cardinals baseball game, woke up, threw up. I'm like, dude, stay home, you're really sick. He gets heat exhaustion really fast, no matter what we do. So it totally, like, we get thrown off, and it's okay. It's okay. There's so much we could talk about here. This is just a little sliver, but I also want it to be a little sliver of hope that you're not stuck where you are, and there's lots of tools to try. And it's true, not everything is going to work. No. And you know what? That's okay, because you tried. You tried something new. You put yourself first. You took care of yourself. You thought, hey, you know what? Alison said to try the Alpha Stim. I'm going to go for it. Or the Healy. Or I talked to 3 therapists, and it took me 5 to find one I really liked. Awesome. Keep going. Keep learning. Keep experimenting. Keep trying. Keep taking care of yourself. You got this. You're not alone. If you need help, reach out. Let me know what's going on. We'll get you taken care of. All right. Enjoy the rest of your day, and I'll see you guys soon.